Hello friends, this is Dr. Amit Karkare and I welcome you to my YouTube channel. Today's topic is Sanicula child, and in short we will see how it saves us from being a confused homeopath. Now why we are confused is, even though we are starting the practice, or even though you are 18 or 20 years experienced in homeopathic practice, the most common difficulty that we find while prescribing is getting mixed drug picture. Despite taking a very good case, we often find it that there are certain symptoms which fit in a specific remedy, but there are the other symptoms which do not fit. Uh, like for example, there are always mismatching situations. The rest of the symptoms they match calcarea, but the patient said that he or she has a very hot feet and they have to be taken out of the covers. We find everything fits into sulfur, but thermally the patient is extremely chilly. So it doesn't. So we cannot prescribe sulfur. We find everything which is fitting into silica, but the patient complains of burning of sores, which is almost a contradictory symptom for prescribing silica. We find most of the symptoms they are fitting into chamomilla, but the patient says that he is in fact better by heat, and in fact the patient is chilly. So these are the typical situations that we encounter during prescribing, especially in case of children. In case of adults, most of the times we do get a lot many symptoms, but in case of children, if the parents are not very observant, which can happen, we do get very mismatching situations. And in such mismatching situations, most of the times we can skip, or we can miss remedies like Sanicula. So what is Sanicula aqua? As the name suggests, it's an aqua. So it's prepared from a mineral water which comes from a spring, which contains trace amounts of natramure, calcarea, borax, and silica. This shows why it shows, or why Sanicula shows mixed pictures, which are like it's a mixture of certain symptoms which are from natramure, from calcarea, from borax, and silica. If you see pregnancy, during pregnancy, the mother who experiences excessive cares and worries, she might be, or she might perceive that she is all alone without support from anyone. This can be an actual situation, or it can be a perceived situation as well. So there is a feeling of being abandoned, there is a feeling of being neglected. So that's a strong neglected and abandoned feeling which she passes through during all her days of pregnancy. As I said again, this can be an actual situation where actually she is abandoned or neglected, uh, kind of situation she is in, or she might perceive that nobody is taking care of her. But that's the situation during the pregnancy. If you see mentors of a sanicular child, the children are typically irritable, peevish, and stubborn, like chamomilla. They have a poor concentration. They usually have incomplete tasks. So typically, the mother will tell you that the classwork is always incomplete. She has to ask other mothers, like mothers of other children, to send the classwork on WhatsApp, and the child hardly completes his classwork. He cannot complete his homework as well. There are strong fears of dark, of robbers, and typically there is a fear of descending. So uh, whenever something is coming down and all those things, so he cannot go into merry-go-round, he cannot go into those roller coaster things. The child is aggravated by getting carried, and he's better by rocked. The irritability, the peevishness, the that manifests into averse of being touched. So there is a strong aversion, strong intolerance of being touched. The child is very restless. So it is a very common remedy that I prescribe when it's a restless child, when it's a child where the school complains that the child does not sit in one place. He has to roam around, he has to play around. And there is a nervousness as well along with that. So nervousness which usually manifests in the form of nail biting. Physically, so typically all these things, all the mentors, they fit into chamomilla kind of personality, but The patient is strongly chilly. It's the Sanicula patient. So Sanicula child is chilly, is better by heat, yet there is an intolerance of clothing. So patient, though he is chilly and he is better by heat, he will prefer to have lesser and lesser clothes on. There is a strong changeability of symptoms, or the symptoms they can alternate. Typically, the child looks with the looks of the child are that there are thin legs and the child is a pot-bellied child. Like natromure, which is present as a trace element in that water, they eat well but they lose flesh. Like sulfur, they have strong offensive discharges, like it's a fishy or rotten smell to discharges. So it can be perspiration, it can be urine, it can be stools. They always have an offensive discharge, or it's an offensive smell that they get. There is a strong exhaustion and weakness which prevails all the complaints. Whenever he is getting fever or diarrhea or anything, there will be strong exhaustion and weakness. They crave for meat, salt, and fatty food. They are habitually constipated. And there is a strong burning of feet, which also has got a fetid or offensive sweating. So fetid and offensive sweating, chilly, that mimics silica, but there is a burning of feet. So that's where Sanicula comes into the picture. This habitual constipation is very key feature of Sanicula. So I have prescribed Sanicula. So more than alumina, I have prescribed Sanicula more in children who have got a habitual constipation, when typically the other symptoms also do match. But one of the key prescription or one of the key uses of Sanicula for me is in the cases of enuresis. It's my key prescription in enuresis when the primary enuresis is coupled with a history of constipation, or the patient is chilly yet there is a lot of sweating, when there are offensive discharges and the child is irritable. So all these things, or a permutation and combination of these things, whenever it's present in enuresis, apart from benzoic acid, apart from causticum, apart from Karkare fluid, Sanicula has given me a lot many cures in cases of primary enuresis, uh, when the symptoms were actually matching. So primary enuresis, when the child has a constipation, just prescribe Sanicula, and I think you can hit a complete cure. So this was Sanicula child for me. We do post various videos on various drug personalities, as well as various topics on homeopathy, as well as bachelor remedies. So if you want to have a notification in your mailbox about our new videos, please subscribe to our YouTube channel. If you want us to make newer videos on the topics of your choice, please use the comment section below, and we'll try to make a video on the suggested topic from you as early as possible. Thank you. This was Dr. Amit Karkare, and thanks for watching my video on Sanicula child.